My name is Dr. Matthew Walker. I do shoulder and elbow surgery for OrthoVirginia. Rotator cuff surgery is the repair of the torn tendons of the rotator cuff. The rotator cuff is made up of 4 muscles. You have one in the front part of your shoulder called the subscapularis, one on the top called the supraspinatus, which is the most commonly torn tendon, and 2 in the back of the shoulder, the infraspinatus and the teres minor. We recommend rotator cuff repairs for any healthy patient that has a symptomatic rotator cuff tear. So if you come to the office with arm pain, shoulder pain, weakness raising the arm, and we find a torn tendon, these tendons don't repair on their own, they don't heal on their own, and the tears tend to get larger over time. So we like to repair them before that happens. Surgical repair options for the rotator cuff, the traditional repair technique has been an open incision with a large soft tissue incision, identifying the rotator cuff tendon and mobilizing the tendon, repairing it down to bone. Currently the most commonly used surgical techniques are arthroscopic with small incisions and cameras. That leads to a quicker recovery time and is often less painful for patients as well. During surgery, it's again an arthroscopic procedure for the most part. The surgery takes roughly an hour. During that period of time, we find the torn tendon, we mobilize the tendon, meaning we loosen up any scar tissue that might have formed, and we reattach that tendon back to the bone where it normally lives. We use multiple techniques to do that. The most common is small metal screws attached to stitches that go through the torn tendon substance. Once the surgery is complete, the hard part begins for the patient. The hard part is the recovery. It takes 3 full months for the tendon to heal to the shoulder, but it can take up to a year for patients to regain full strength and motion in the shoulder. In the past, we've generally used an open rotator cuff repair technique where we make a large incision, mobilize the tendon, and repair it down to the bone. Nowadays, the most commonly performed rotator cuff repairs are done arthroscopically with small incisions and a quicker recovery time.